we're going with my colleague Alexis talk to you about a specific topic that we focus on at the GDHUB. So I'm digital health advisor, and Alexis is a postdoctoral researcher in computer science. So let's go directly into the topic. So we want to introduce a topic about innovating access to digital health knowledge. So I'm going to give you overall context information, and Alexis will take you into the very technical aspect of the platform. So first of all, we are the GDHUB. So GDHUB is the Geneva Digital Health Hub. So we are actually based, of course, in Geneva, but at the University of Geneva. And we are really focusing on building a specific science-informed and equitable future for digital health. So we are working with the national government of Switzerland, with the hospitals of Switzerland, what they call the GDHUB, and the World Health Organization in that purpose. So we are actually focusing on 4 main pillars that you can see here on the slide. So the first one is really about science, communities, tools, and also implementation. I would say implementation is really one of the core actually domain. And we really want to bridge implementation and policy to create sustainable and long-term change in digital health. And for that, of course, we need tools. And one example we're going to show today to you. And we need to empower communities as well, that makes sense, really to foster meaningful collaboration in the field of digital health. As we all aware of the different complexities in the digital landscape, we have a lot of different scarcities, disparities at different level and regional level. And what we notice that most of the time we see, you can see the picture, we don't necessarily see the complexity of digital health. So we all actually seeing different parts of the elephant and not having the food landscape. So we're missing definitely, opportunity to leverage concrete digital health outcomes. So beyond the metaphor, to really tackle this issue, we're doing 2 main, I would say, activities I want to summarize. We need to report, and develop guidelines to really making sure we can have a better understanding of what existing on the field of digital health. So we developed this guideline called iCheck, so you can go and look for the publication, and basically it gives you a list of items to make sure that you report properly your implementation through a report. And it's supposed to facilitate, of course, sharing of knowledge. That's really what we want to focus on. And here you have on the slide a different report that you can download if you want to know more. And we actually now a call of papers, so we're working with GMR. And you can publication, you can, if you want, if you're in the field of medical informatics, there's a call you can see on the slide to really focusing on real-world implementation from the industry, I would say, domain. So I'm going to stop here, and I want to let Alexis now taking you to really, I would say, the core activity that we wanted to share with you today. Alexis, the floor is yours.
I take you Okay, hello everyone. So a major issue in digital health is the lack of accessible and organized knowledge, leading to some isolation of people working with similar things all around the world, and that can result in kind of duplicated works or misleading opportunities, etc. So starting from this point, our goal is to transform our implementation knowledge into public knowledge that everyone can access. So the solution we develop is Implementome. It is a platform that has been launched in 2022, and from which a new version is going to be released in the beginning of December of this year, so in 2 weeks. And so the objective of this platform is to capture, to organize, and to use knowledge for implementation challenges of global digital health. And this is done in combination with IA tools to make this all of this very accessible and usable. So Implementum is a project-driven communities in which the data is filled by users. So the data inside is open access. The objective is visibility, like in a global way, and so this data is up to date since it's the stakeholders that update their own project over time. And so inside the platform, we develop data analysis tools that are interactive tools helping people to understand all of what is inside the platform. And we have the AI assistant in which you can ask to get really into the data easily. So I will show you in what look like this platform. So first of all, the platform is available in French and in English for now, and we are going to work to have it in a lot of more languages so that everybody can access and read it all around the world. To get into the project and use the platform, you can create an account, and we made it easily since you just have to, if you want, just connect your LinkedIn or your Google account and directly can use everything. So that's easy for the community. And so when you are in the platform, you have access to this toolbox. So the toolbox, there are 4 main tools. There is a digital health atlas, which is an improvement of WHO1 with an interactive maps with all of the projects. You have the community of practice that connect all users that can interact about digital health. The AI assistant in which you can ask about the data inside the platform, and science map to have information about all the literature in digital health with hundreds of thousands of papers extracted and accessible from it with statistics, analytics, etc. So I will present you it more in detail. So this is what the science map looks like. You have an interactive maps here with all of the projects that are entered by user. You have the list of the project, and you can use this filter to get into the data and see specifically what you want to have, or use a search bar, sort the project, etc., or add your new one. And so this button is interesting since we have a kind of certification of high quality data, and if you want to be sure that the data you use is of high quality, you can activate it and access only this data. So that is really nice for studies. So that is how the project looks like the page that you can access for all the projects. There are, for now, there are around 1,000 projects in the platform coming from WHO and some others. And this is an example of the use of AI assistant. So you ask the question about the data inside the platform, and it goes into the database and give you a specific answer. So for example, are there any telemedicine projects which have scaled in Mali? What can we learn from them? And then it gives you the answer directly from the data inside the platform. The science map is a tool, so we extracted for now 100,000 of paper that has been categorized, and there are some statistics you can filter, etc. So this is a tool that we developed to help people understanding state of the art on digital health. So you can see trending topics, select specific domain, and see what are the main subjects that are published inside it, etc. And it is going to be updated all around the time. Okay, and finally, there is a community of practice in which all the users of the platform can interact to talk about projects or talk about digital health in general. For now, there are more than 10,000 people that are registered in the community of practice, so there are really good interactions, and there are webinars that are organized, meetings, etc. So you are very welcome to join it, and yes, thank you.
Thank you, Alexis. So I will just finish the presentation to give you some key numbers. If the next slide is coming, yes. So recently we actually notice an increase in the number of, I would say, people interested in our platform. So we have now reached 10,000 members on LinkedIn, and also, as Alexis mentioned, over 100 members on the platform of MIT. I think what also to emphasize to what Alexis said, I think it was really interesting is this MIT social media platform. They're really going to connect to peers sharing the same level of interest. You can have also specific, I would say, secret, for example, groups, if you want to focus on task forces, for example. And we also leverage on events. Last year, we have a major event that we did on digital health with the WHO and GDHUB Forum. And after this first edition, we also saw an increase of people willing to go on the platform, but also connecting with us. So actually, we are more than welcome to come next year for the second edition of this event on digital health in Geneva. So now concretely, of course, we are coming here also to with a specific call to action. As you can see here, we are really ready to launch this new platform in Nairobi in 2 weeks during the Global Health Forum, and we have a very thorough process to improve the platform. And we want to know concretely here what could be the value for the private sector right now, because we're working a lot with academia, with the public sectors, with different NGOs. And we believe that what could be interesting maybe for you is access to a very broad database that is created for most of it, as I mentioned Alexis earlier. And also, you can gain knowledge from existing initiatives, from probably the challenges they face, solutions they had to mitigate those challenges, for example, and also foster synergies in that purpose to improve. That's why we all want actually global health outcomes for populations. So it's really important. So what we wish after this presentation is really willing to hear from you and to follow us and help us to keep building this platform. So how can you get involved? You can actually already connect and put your initiative, your project on the platform. That's a good way to start. And you can be a kind of VIP tasting user if you want, and share us some key improvement that should be done in that purpose. And we want to have this kind of continuous purpose of improving the platform, for example. So because I see that we're running a bit of time, I'm going just to stop here and just let you know you can ask for a demo. You can also connect with Alexis or myself if you want to do more. Thank you very much. And now we have maybe around 1 minute and 30 seconds for any questions, if you have any questions to us. Thank you very much for your attention.
Thank you. If you have any questions, please raise your hand. Otherwise, they can email you for requesting a demo.
Of course, they can email us. We'll be available to answer any questions, definitely.
And you can find them after this session as well, or outside at the networking segment.
Yes, thank you very much. Have a good evening.
Thank you so much.
Bye.
Thank you.